Good morning. Good morning. Good morning. Well, testing 1, 2, 3. Testing you and me. I got a cold. I'm sick. I got something. This is revenge. It's either God hating me or I just got a whole baby shower sick because yesterday I was feeling awfully gay. My friend, she invited me to her baby shower, and she's my good friend. I love her, blah, blah, blah. And I'm like, all right, and so I invite my other friend. Me and my friend go to this baby shower together. Yeah, I was the only man at the baby shower. I was the only male. I was the only penis hanging at the baby shower. Even the baby was a girl. So I was all alone. Me and Doja. A canine. A fellow dogger. Alright, so I left there going, oh, I just got hustled. Anyways. Yeah, so I was like, okay, I'm officially gay now. I'm going to fucking baby showers. Still not getting laid, but what the fuck, whatever. Asexual. Alright, so now I got a sniffly nose. So, I either got all those fucking chicks sick. That's what you get for inviting a boy. Or them fucking bitches got me sick. Double up. You're gay and you're sick. You're a sick gay man. We knew that. No, we didn't. I didn't know that. If you knew that, why'd you tell me? Why did fucking hold that for me for 46 years? Cameron, you're a sick gay man. No. Yeah, really? Okay. So, I've got the sniffles today. I wonder if I could sue Facebook. Because I'm on suspension. I'm in timeout. I got a 7-day timeout. I don't even know what for. Well, I do. I do know what for, but not specifically what for. And because I can't comment in general, I can't tell my 43 followers. No, I don't know, 100. Like 2 people follow me. I've got 100 friends that no one wants to know what I'm doing. They all know what I'm doing. They all think I'm fucking hookers, doing drugs, and making money. Not doing any of those right now. Breaking even. So, but by them banning me or grounding me or censoring me, I can't notify people in general that, hey, I'm sick, I got sniffles, beware, if we've been hanging out, whatever, take the proper procedures, whatever you feel those may be. Alright. Yeah, so Facebook is in essence endangering the public, which anyone who believes in the First Amendment, anyone who believes in the Constitution, realizes deep down that censorship never achieves the goal it says it's achieving, and it's never instituted for the reasons the commie bastards who want to censor say it's for. All right. All right. So, if you want to find out if Cameron's spreading the COVID to everyone because he's such a slut, you have to come to my podcast, The Spokane Experience. It is 4 o'clock in the morning. It is 10/17/2021. And you're here with Cameron Vesey, The Spokane Experience. All right. So, this morning, it's Sunday. Football doesn't start forever. I don't feel so well. What's weird? I know, I just took all my vitamins. I don't know. I just started some more antibiotics. I started those yesterday. I don't know. Maybe I don't know whose fault it is. I don't know if there's anyone to blame. Let's get past this. All right. Get all the sleep out of my eyes. So, this morning, this is the Hill. I don't like the Hill. Sometimes they do all right. Sometimes they just go back to the old fucking mainstream media bullshit. This is mainstream media bullshit. So, what is my audio? All right, check your audio. There we go. Why won't you guys get me some glasses? Send me some money so I can see what I'm doing. Options. Audio. No, I don't want to. Okay, so. Well, we know this is working. I'm not quite sure if that's working. I'm not wearing it around my neck because that little rustle was probably annoying. That's probably annoying. Sniffle. All right, let's get to it, Cameron. Okay.
From a long-running study in the UK came in yesterday, and the results were shocking, even for people who already believed that the vaccine.
Don't pull the mic out. Don't pull the plug on the mic as a method of mute. It just fucks up your whole program. All right, so I have microphone and stereo on, so this might double up. Am I recording again? I am recording. So, how do we do this? All right, so let's listen to The Hill this morning. Okay, so let me a little background. I started listening, because I try to make sure I'm open to actual statistics that say it's getting worse, actual statistics that might say, okay, we need to start listening to this. It's this variant might be bad, or it's might mutate into something. I'm trying to listen for the time I go, okay, we're all fucked, right? Because I like orgies, and if we're all fucked, that means I might. Never mind. I'm sick. I'm sick in the head. All right, so let's get to this. All right, so I start listening to this. I'm going, oh, this might be serious. I start going, oh, is this positive? Is this negative? I don't know. I don't know which direction they are. I try not to assume which direction they're going. So
Ryan, tell us what's on your radar.
The data from a long-running study in the UK came in yesterday, and the results were shocking, even for people who already believed that the vaccine was doing a good job protecting people from dying of COVID. The researchers, working on behalf of the UK's Office for National Statistics, studied 51,281 people who died of COVID over the 6 months from January.
I'm sorry, lots of sneezing.
To July, which included the period when Delta was surging. Overall, the UK found 640 people who had gotten both shots among those who had died, which makes up roughly 1.2%. Of those, just 248 were fully vaccinated beyond their 2-week period when they got infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated, 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely vulnerable. That tracks with what 2 hospital chains recently reported, finding that between 97 and 99% of those hospitalized for COVID were unvaccinated or not fully vaccinated. Those who died, both vaccinated and unvaccinated, were more likely to be older and to be vulnerable, as we've known a long time, though the age at which people are dying has begun to fall, as the elderly have gotten vaccinated at much higher rates. At a Tampa hospital, the median age of ICU COVID patients was 46. This is a chart showing the portion of deaths among people under the age of 55. As you can see, in the beginning of the pandemic, those younger people made up a small number of those dying. But now they make up more than 1 of every 5 COVID deaths.
All right, I'm going to have to piece this together today because I keep hitting the wrong buttons. All right, what did that tell you? What did you get out of that 2 minutes of numbers and numbers, percentages and percentages and numbers? at first, because I was like, oh, okay. But then, if your mind is trained to be perverted, to listen closely. You see, Mark Twain said, there's lies, there's damn lies, then there's statistics. Statistics are based on how you frame the numbers you're presenting. It's in the framing that's important, because it's in the framing that you can find anything. How is this motherfucker framing these numbers to make them propagandist and scare you into getting the vaccine? Because that's what they want you to do. Because I was talking with my friend Pam Davies. She probably hates me saying that out loud. And she wants to believe in the goodness of people and people who vote blue because they're the good ones and conservatives are bad. Now, she's not like that anymore. Because it's hard to be best friends with somebody who's conservative and realize that, oh, they're not half as evil as you thought they were. Or you see a different perspective. This is why culture works. This is actually how diversity is supposed to work. Because she affects me as a more blue voting person. She's pretty conservative, but she's a social justice warrior. My best friend's a social justice warrior. Me and my mother didn't get along over these issues. Anyways, one of me and my mother's favorite things to do was to fight over about Fox and MSN. She's an MSN, I'm Fox back in the day. I'm neither now, and so is she. We've come to terms with it. Never mind. She's dead now. Not funny. This motherfucking computer has a phantom fucking gremlin in it that likes to push pause when I ain't fucking looking. That's when they like to play. So here's the problem with this propagandist motherfucker. All these numbers he's using to scare you are really saying things are getting better. They're getting better, all right? If you listen closely to those numbers, right, you'll see I'm attractive. You'll see I'm not as fat as I look on TV. No. If you listen to the numbers, he's actually saying things are getting better. How's that, Cameron? Well, what those numbers are saying is that enough people are getting inoculated, enough people are getting vaccinated, so that whatever number's left, which is tiny, it's like my penis, right? Whatever number's left is the size of my penis, and therefore, no one is ineffectual. Is not important to anyone ever, anywhere, not even me. Probably not a good example. Okay, so if we listen to the numbers, if we compare the numbers we're talking about in this segment to maybe the numbers last year, there's probably no significant change in the rate at which unvaccinated 45-year-olds are dying, or anyone under that. Oh, here's the point I was trying to make. Let's put this in perspective, which they don't do here. This is the problem. They frame these numbers as if they exist by themselves in a vacuum, all right? But they don't. They lift numbers outside of reality rarely represent reality well. So in order for numbers to properly be represented, we have to compare them with something else in reality. These numbers are this reality. These are numbers of this reality. Resolution, focus, big picture, small picture. We need to take those into consideration as we frame the numbers for those numbers to have any real meaning to us so that we can better prepare and plan. This is why decentralized government, decentralized control is far more wiser and smarter than centralized, because centralized can only frame things at a certain resolution, where locally things can be, okay, Thomas Sowell. No, I don't know. Is that Thomas Sowell? Okay. if we want to just look at being kind, all right? Chicago. Now, I don't like unions, but I am a constitutionalist. I am an American, so I totally understand that people have the right to form unions. That's their God-given right. That's their constitutional given right. It doesn't mean I have to like them or agree with them or even think they're that beneficial, right? Just like you might think freedom of speech and hate speech and me saying things like nigger or some other hurtful word, censoring that would be beneficial. Maybe you're right, maybe you're wrong, but you don't like me saying it, even though it's a protected speech issue. Okay, I get that, but I have the right to say it, and you have the right to fucking not like me saying it, but you don't have the right from stopping me from saying it. Otherwise, you can call the cops right now and say, "Hey, that dude said nigger on the air. Let's go arrest him." You can't do that because it's not against the law because it's a protect the right thing. Okay, so that being said, I don't like unions. I would technically, if I was governor, be something of a union buster. I don't like them. But I'm honest with myself, and I totally understand that Americans have the right to unionize. All right? Americans have the right to be dumb assholes, just like I have the right to be a dumb, provocative bigot, or whatever you want to call me. Whatever. Names don't hurt me, because nobody follows me anyways. So, like, who's going to care? 2 people? Oh, no. Chicago, unions. The police union in Chicago, they raised 2 points. That, A, you don't have the right to ask me about my medical well-being ever. HIPAA. Pardon me, I gotta sneeze. So the Chicago unions are basically pointing out that you don't have the right to ask anybody their medical status. Hey, are you HIV infected right now? I don't have the right to ask you that. Maybe you're obliged to tell me before, I don't care if you're HIV and you suck my dick. Only if it's reverse. That's probably rude. Just say, it's easy to get. Who was I insulting? What was I doing? Saying something wrong. All right, so the Chicago Union Police Department says, look, you don't have a right to ask me my medical status. That's a HIPAA thing. That's a right. That's okay. Second, we didn't negotiate that into the contract. You're trying to implement something that's not in our contract. We signed the contract. You signed the contract. That's capitalism, baby. What people don't understand is all capitalism is, all right, is saying we have the right as private citizens to sign a contract, and that contract's valid even with our government. The government can't come in and just squelch contracts willy-nilly depending on what they think is more advantageous at the time. That's why justice is blind. Justice is we have a contract, and then justice decides who lived up to that contract or who breached that contract. The state does not have the right to say our contracts aren't valid, but theirs are. That's capitalism in a nutshell, all right? Saying we can have a contract privately, and whatever we agree to privately, we both must uphold the best we can. Okay, now, in a nutshell, that's capitalism. So, when the unions, which are, generally people who go, oh, we hate capitalism. No, you don't. You love capitalism. Make a contract with the city, and the city signs it and they signs it. Doesn't matter what Biden says, right? Especially if what Biden says is unconstitutional, which it is. But the city can't come in and say, well, the contract's not up for 2 years, but we're going to implement something now and demand you live up to this contract, this non-negotiated part, or we'll fire you. Can't do that. It's in the contract. Okay. So those are the issues. Whether you agree with the union or you agree with that racist mayor that governs Chicago, it doesn't matter. What matters is whatever COVID precautions, mandates, whatever, if the remedies to the supposed pandemic crisis, if the remedies are, if the cure is worse than the disease, then don't cure the disease. Because if the remedies are worse, you don't put bleach in your veins to cure COVID, do you? Right? If I told you eating a bullet will cure your cancer, you don't shoot yourself in the head and say, fixed that one, didn't we? If the cure is worse than the disease, then it's not a cure. All right. If these mandates are being imposed, it doesn't matter whether the union resists them. All right? It's the fact that by imposing them and people resist, if that causes more damage than never implementing those mandates to begin with, then the mandates are ethically wrong, morally wrong. All right. Pre-COVID, the amount of children getting shot and killed in Chicago was a number. Horrible number, but a number nonetheless. Between shutting down businesses, laying off police, cutting budgets, all left-wing Democrat policies based on COVID and George fucking Floyd, right? And then these mandates are going to cause a bunch. Last year, more children were killed in Chicago than any previous year ever. Why the increase in violence? Lockdowns, staff shortages, hospitals turning away anyone that isn't COVID. COVID policy has caused a major uptick in children dying from gunshots in Chicago. Enough children that more children died this year in Chicago shootings than died from COVID since COVID began. That's one city's, that's one minutia, unforeseen consequence, that's causing more children deaths by mandating vaccines, by COVID policy, is causing more deaths in Chicago alone than COVID caused in the whole United States. The cure is not worth the disease. Better off let the disease run, because the cure is killing more people, more children, than the disease. Period. You can't get around that. If that's just Chicago, and you want to weasel around, well, maybe it wasn't COVID, this, maybe it was, well, a lot of it's got to do with COVID. And then if we spread that out to Houston, New York, LA, Seattle, yeah, the numbers start getting ridiculously stupid that the cure is far, far worse than the disease. Okay. Just want to say that because that's today. That's real facts about today. All right. This gentleman's actually producing statistics that are beneficial, saying, oh, it's getting better because look, less old people are dying, less people are dying in general, so more people aren't dying that are unvaccinated, more people aren't dying of COVID than last year, less are. And because less people are dying because more elderly people are getting the vaccine, the ones left over, which are way, way smaller, way, way less than last year, are going to be in a different category. But here's something I really, really need to point out, which they don't mention. They don't want to mention this because this will break their fucking ass. All these numbers, the one he doesn't tell you, 78% of patients that are hospitalized for COVID are clinically obese. You don't hear that number. You don't hear that number to you, huh? You don't hear that number. Because that number makes all the numbers he's talking about mute. So let's listen again. Only 2 minutes. It only takes 2 minutes more of your time if you listen this fucking far. So let's listen to this again, and keep in mind that these numbers are all way smaller than the numbers last year by COVID, which they don't compare. They just tell you the small picture of it. And now, as he's talking, every one of these deaths, 78% of them are obese. Think about that when you're listening to it, and tell me where the real problem is. Is it unvaccinated, or is it fat fucking cows shoving food in their face, being lazy, being whiny, probably too lazy to live? All right, let's try it again.
And the results were shocking, even for people who already believed that the vaccine was doing a good job protecting people.
See, so I guess we know how he's framing. He's trying to frame that the vaccine's doing a good job, right? Where it's not necessarily doing a good job. This is so nonsense. There's so many things that he doesn't take into consideration. Like, one, what part of natural immunity? It doesn't say how many of these people who had. Here's another number they're leaving out. How many of those people who are vaccinated who aren't dying also had COVID? Because if you had COVID, your immune. How many of these unvaccinated people are non-previously COVID patients? There's all sorts of numbers here being left out that you have to have before you say, look how great the vaccine's doing. That's a problem.
From dying of COVID. The researchers, working on behalf of the UK's Office for National Statistics, studied 51,000...
Office, I'm going to say it again, lies, damn lies, and statistics. Mark Twain.
1,281 people who died of COVID over the 6 months from January to July, which included the period when Delta was surging.
Again, the numbers he's leaving out, how does that compare with people that were dying last year, right? How does that compare to people dying of all sorts of other things, like heart disease or cancer or car wrecks or whatever? All the numbers that are not being encapsulated into this research, they're purpose or not, doesn't matter.
Studied 51,281 people.
We don't know how many of those people never had COVID before. Were these all first time? And if 78% of them were fucking fat and never had COVID and they were fat, that's a big deal. I will try and shut up.
Who died of COVID over the 6 months from January to July, which included the period when Delta was surging. Overall, the UK found 640 people who had gotten both shots among those who had died.
Both shots, but not whether or not were they COVID clean? Was it the second time they had COVID? Was it third? That's just important to know.
Which makes up roughly 1.2%. Of those, just 248 were fully vaccinated beyond their 2-week period when they got infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated, 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely vulnerable. That tracks with what two hospital chains...
This is where I'm listening to it again. Second time where you're. Did they just say they weren't obese? So, if you're clinically obese, does that put you into these categories limited by long-term health problem or disability? Does the UK consider obesity a long-term health problem in this study? I don't know. Because they don't give you the raw data here. They give you these labels in order to do science. And you can't assume. I'm trying not to assume. I'm saying, well, maybe that 78% that I thought earlier, maybe it's wrong. I'm not sure. I don't know, though. Right? I do know that these numbers aren't the same as last year's numbers. I do know... well, let's listen.
recently reported, finding that between 97 and 99% of those hospitalized for COVID were unvaccinated or not fully vaccinated.
Okay, so wait a minute. Wait. These motherfuckers are sneaky.
Were listed as not clinically extremely vulnerable. That were at 43 fully vaccinated beyond their 2-week period when they got infected.
So here, 1.2%. Okay, 1.2%.
The breakthrough deaths were more common among men, they found.
Breakthrough deaths. Another term. What's that term mean? What does a breakthrough death mean? Scientifically, statistically, what is the category of breakthrough deaths? All right, so now they're going to throw another label in there that now I have to go research so that I'm aware of what they're saying when they say that. You know, I don't want to assume what a breakthrough death is based on assumption and other things.
Among those who died unvaccinated, 43.4%.
Among those who died unvaccinated. See, they throw so many fucking numbers out there so fast, so quick.
Percent of the researchers working on behalf of the UK's Office for National Statistics studied 51,281 people who died of COVID over the 6 months from January to July, which included the period when Delta was surging.
Our study group is 51,000. They all died of COVID. All right.
Overall, the UK found 640 people who had gotten both shots among those who had died, which
that's a low number.
Which makes up roughly 1.2%. Of those, just 248 were fully vaccinated beyond their 2-week period when they got infected.
So a third of the people that die of COVID, a third of them had all their shots. That's actually kind of what he's saying right there. You can flip these so easy. What he's saying is if you died from COVID and you've been vaccinated, a third of the people that die are fully vaccinated. The people that died from COVID that have been vaccinated are fully vaccinated. A third of them. You can twist these any way you like.
Infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated.
So wait. Is a breakthrough death someone who died from COVID that had all their shots? Fuck, I did not see. So are we talking about, okay, so of the 640 deaths, 240 of them were fully vaccinated. Of those, 43% of them were men. See, that 43% makes this whole thing sound pretty big. Now let's go.
43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability.
All right, so, yeah. Flip those numbers. All right, let's get a calculator. these fucking cocks. Now watch, this is how you do it, because my mind's almost trained to hear when some bullshit's going on. All right, so let's just do this together. You and me, baby. 51,000 people, right? Minus 19,000 people. I'm going to guess 19,000 is about 22%. 22%. Why am I guessing that? Because that means 78% are fat, fucking lazy motherfuckers. Yeah, okay, 32. Oh, geez, so 32,000. Let's cheat here. Oh, I'm sorry, you can't see this. I'm cheating with a calculator. What percent is 32 of 52? Well, there's a nice number. So what this news program is saying, people, out of 51,000 COVID deaths of unvaccinated people, most of them are all unvaccinated. 1.2% were vaccinated. Very low number, okay, but out of those 51,000 deaths, 66% of them had underlying health issues or fat and obese. That is the root of what this motherfucking thing is saying is if you're fat, if you're obese, and it doesn't matter how old you are, you're probably going to fucking die a horrible early death. You lazy motherfuckers. See? Isn't that great? Unless you're a fat, lazy motherfucker like me, you don't have to worry. And I'm not worried. I'm going to smoke another cigarette, eat some more cake, and see if I can't get a gay date, because I'm apparently gay. Anybody have a wedding shower I need to go to this week? Fuckers. All right.
And 25%, or more than 11,000, were listed as not clinically extremely vulnerable.
Okay, now, whoa. Did he double up on numbers there?
Vaccinated. 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely.
So is that 11%? That 11% is part of that 19%. That's not like 19% were like this, and then a 20% was like that. So that equals 41%. That's not how that works. 19% were like this, and that 11% of that 19%. See, they try to double up the numbers. Those are almost the same statistics.
Vulnerable. That tracks with what two hospital chains recently. Of those, just 248 were fully vaccinated beyond their 2-week period when they got infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated, 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than
shows you how dumb I am. So 43%, yeah, that means 66% are fat and obese. I didn't even need to use a calculator.
11,000 were listed as not clinically extremely vulnerable. That tracks with 4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely vulnerable. Were listed as not limited.
The numbers are worse.
Vaccinated beyond their 2-week period when they got infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated, 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely vulnerable.
So, that's probably the number we're looking for. 11% were not listed as extremely vulnerable. So if you flip that number, that means 89% of the people who died of COVID unvaccinated were in the category of extremely vulnerable. Duh. It says if you're of the category of extremely vulnerable, you should probably get the vaccination. You should probably get vaccinated. If you're of the category of the extremely vulnerable, you should probably get vaccinated. Yes. All right? Because those numbers just said that 89% of the people who died from COVID, unvaccinated, were of the category of extremely vulnerable. Tell me I'm wrong.
The UK found 640 people who had gotten both shots among those who had died, which makes up roughly 1.2%. Of those, just 248 were fully vaccinated beyond their 2-week period when they got infected. The breakthrough deaths were more common among men, they found. Among those who died unvaccinated, 43.4%, or almost 19,000 people, were listed as not limited by long-term health or disability, and 25%, or more than 11,000, were listed as not clinically extremely vulnerable. That tracks...
I'm wrong. I think I might have been wrong there. So we're talking 19%. It's hard to take out whether. So if 19% weren't of a lesser disability, and that 25% is within that 19%, then yes, the number still is 66% of the people who are. I'm sorry. So yeah, just this is how just making sure the numbers are right. 66% of the people died were of a vulnerable or extremely vulnerable classification, which means multiple heart condition, multiple underlying conditions, or fat and obese. 66% of the people dying unvaccinated were of this category. That's what they're saying. So again, if you fall into that 66%, you should probably get vaccinated. Then you won't die today. And then we get to the numbers that, all right, wow, that sucks. 19,000 people a year, times 2, because this is a 6-month study. So that would be 40,000 people a year. Unvaccinated are still probably going to die. And that's going to suck because they're not, I don't know, 40. No, that can't be right. 19,052. So it'd be out of 100,000 people that get studied. Oh my God, the numbers. See, oh my God, see the fucking numbers. They just put them out there so bad that it's really hard to get a sense of what they're saying. They're saying out of 51 people studied. How many people total got that's just how many people were studied. Fuck. See, so here's the real lesson. If you're fat and obese, get the jab. If you're a lazy motherfucker and you like to feed your face and smoke cigarettes, you should probably get the jab. I'm not, because I'm none of those. I'm not fat, obese, lazy, and smoke. Fuck, not me. What was the other thing? But what it's really saying, though, is these fucking news agencies need to shut the fuck up with all these fucking numbers and all these fucking comparisons, because they've only got one purpose. Get jabbed. Get jabbed. Get jabbed. Look at numbers. Hey, look, numbers. Jabbed. Jabbed numbers. See? Better jabbed. Oh, you're better off jabbed. I don't believe so. I believe the starting data. I believe there's probably conscious biases in these studies. They're by a certain type of fucking scientist that wants certain type of results, so they're going to find certain type of numbers. All right? But yeah, if you're fat and fucking lazy, get the jab. All right? They'll probably come to your door if you fucking make a call. All right? I don't know. That's probably as much as a Spokane experience I can handle in one day. How about you? All right, everyone. I'm probably signing off. Check on the ones you love. Check often. Fuck COVID insanity, man. Stop watching. I watch these fuckers. That pisses me off because I have bullshit meters in my brain that go, oh, something's not right with those numbers. What are they trying not to say? So what that means, what are they really saying? All right. Love everyone. Have a good day. It's Sunday. Go Hawks. Fuck the Steelers. They stole a Super Bowl from us.